Hi, it's Congresswoman Jan Schakowsky, and I'm back with my plans and pans. I hope that you have had some time, as I have had, to spend with your families. This is a time of Passover, it is a time of Easter, it is a time of Ramadan, and these are moments that we treasure. Well, there's also some not so good news. A judge in Texas ruled against the allowance of a drug called Mifepristone, which is the most common drug that is used for medication abortions. This judge ruled that the Food and Drug Administration had not adequately tested mifepristone for efficacy, for safety, not done the science. And so he says it should not be used, but he has now stayed this decision, giving time to the Biden administration to appeal. Mind you, that mifepristone has been used for 20 years, effectively, safely, and it has been researched up and down over the years. It has been used all over the world safely. So this is not about the safety of women who want to have a safe abortion or to have an abortion at all. This is their way to get nationwide a prohibition on this very important drug that is used by so many people. Understand, this would apply nationally. This would be the first one of these restrictions on abortion that would be applied everywhere in the United States of America. And that means that women who have ectopic pregnancies, women that are having miscarriages, and of course, the women who want to control their own bodies and make a decision. And so we are looking forward to protesting this terrible ruling by the judge and to be able to protect women's rights to an abortion and to their choice of a method for abortion. Well, last week, another federal judge in Texas decided to strike down some elements of the Affordable Care Act. Some of us have called that Obamacare, and it has provided so many people in the United States of America, millions more, with health care. But this time, what they went off on was the preventive services, saying that too many preventive services come without any co-payment, and that should end. Among the preventive services that they want to exclude include mammograms, lung cancer and skin cancer screenings, help for pregnant women and children, also medication that is used for lowering the existence of HIV/AIDS, and many more. The preventive services that they want to exclude will touch the people that have the most need for health care right now. It has been such a boon for the health of our country, for the health of literally millions of people, that without a co-payment, they have been able to get access to these really important screenings. And that means, of course, that illnesses can be detected earlier. They won't go into much more expensive healthcare needs. This is a very, very bad decision that has been made. Some better news: the Center for Medicare and Medicaid Services, CMS, cracked down on Medicare Advantage programs, saying that if they wanted to maintain their legal status, that they would have to name exactly what the program that they were using was, what the policy that they are offering is, and that they cannot use Medicare's name in any kind of misleading way, because it is not Medicare. This is private insurance. And so I think this is at least a good start for us to be able to know that Medicare is Medicare. And when it says you can dial 1-800 for Medicare Advantage, that it is private insurance And we know that in 2020, Medicare Advantage received $12 billion in excess financing from the federal government. And we think that we want to make sure that you, if you're of Medicare age, get what you deserve and that we aren't overpaying those who are taking advantage of Medicare. I've told you about my community project funding that allows members like me, all the members of Congress, to be able to have 15 different projects within our own districts that we can help fund. Well, just this week, I was able to go to Family Focus. It is really a bedrock in our community of services and programs for young people, particularly in the Black community. And Family Focus has been around for so many decades now, and it has been located in an historic building that actually was built in 1905. As you can imagine, this building has undergone many renovations over the years, but even to the point earlier, a couple of years ago, where they were considering about selling that building altogether, which would have been a great loss to the community. And so I have been able to provide $1.1 million to help renovate this building. The state of Illinois has also come up with some funding, and they are doing fundraising to make sure that a building can be created that is going to serve the needs of the children, but also make sure that it's a building that is really safe and healthy for our children. I've been involved with Family Focus for a very long time, and it deserves to be a pillar of our community. As I've told you before, lead service lines have been a problem for a long time, particularly in Illinois, where we have the second highest number of lead service lines in the country. Well, I told you that in Skokie, I was able to help them with a couple $1 million to replace lead service lines. But the other good news that we have now that came just this last week is the state of Illinois is going to be getting $230 million to replace lead service lines that is coming from the federal government. Now, you know, the federal government, all in all, is spending $15 billion to replace these lead service lines. And we're so happy that a good chunk of that money is going to come to Illinois. It's still not going to finish the job, but it's going to help us make good progress so that the children, the families, all of us are drinking clean water from our service lines and not have lead in them. I really can't end without mentioning what has been going on in Tennessee. As you know, there was a terrible mass shooting at a school where 6 people were killed. 3 were children that are 9 years old. So this was horrific enough that some members of the legislature in Tennessee joined protesters who were calling for sensible gun legislation in the state of Tennessee. 2 of those just happened to be 2 Black members of the legislature who were joining in that protest, now have been expelled as members of the legislature by a vote. Imagine that. There's been an enormous backlash to what was done in Tennessee in that legislature. They will be allowed to be reinstated because the counties that these members came from have the right to reinstate them into the legislature. But what is democracy about if there can be members of a legislature loudly proclaiming their view, and then because it goes against the view of about 2/3 of that legislature, be expelled altogether? This is rumbling around the country. It shocked many, many people. And this is not something that can persist in our democracy. Well, I had to get that off my chest. I am hoping that you feel the same way I do, that first of all, we need to prevent gun violence, and second of all, we need to allow people to speak their mind. People inside the legislature, people outside the legislature, without being punished. Well, I'll see you next week. Thanks so much for watching my Pans and Plans. Thank you for watching my video. Make sure you subscribe to my YouTube channel and follow me on Instagram, Twitter, and Facebook, where my handle is @Jan Schakowsky.